Good morning. I want to talk about a betrayal. It's the most frustrating health paradox after the age of 60. You are diligently taking your prescriptions, trusting your doctor, trying to stay healthy. But what if the very pills you rely on, the ones for sleep, the ones for anxiety, the ones for pain, were silently, chemically robbing you of your memory? The process is hidden but simple. Your brain runs on a fuel called acetylcholine. Think of acetylcholine as the electrical current that powers memory, focus, and rapid thought. Many common medications contain a chemical component that acts like a key that shuts off that electrical current. It blocks the acetylcholine. We call this the anticholinergic burden. This isn't a theory. This is clinical fact. I am referring to the shocking research from UCLA, which found that continuous use of these specific drugs can literally shrink the memory centers in your brain, the hippocampus. I'm Dr. Anya, and today we're going to fight back. We are going to expose the hidden danger in your medicine cabinet. I will give you the knowledge you need to protect your mind. We are starting the official countdown of the 9 most common medications that drive this dementia risk, and I will show you exactly what to ask your doctor for instead.
We begin our countdown with medication number 9. This is perhaps the most insidious risk because it is sold right over the counter without a prescription. Over-the-counter sleep aids such as ZZ-Quil or generic nighttime cold medicine. You take these pills to help your brain turn off for the night, but the main active ingredient is often a powerful first-generation antihistamine. These drugs are highly anticholinergic, meaning they are designed to block the acetylcholine that controls your memory and focus. The consequence is not just sedation, it's confusion. That lingering mental grogginess you feel the next morning is not good sleep. It is a chemical hangover. Continuous use of these pills, even at low doses, contributes directly to your anticholinergic burden, making your brain less capable of forming new memories. I had a patient, Mrs. Rodriguez, 78, who was taking one of these pills every night for years. She was convinced she was developing Alzheimer's because her memory fog was so severe. Once we identified the nightly pill as the cause and substituted it with a non-chemical sleep solution like magnesium, her confusion began to clear up immediately. The medicine was the villain. My rule is simple. Do not rely on these pills for chronic sleep issues. They are an emergency measure at best. If you need sleep assistance, ask your doctor about non-anticholinergic alternatives like trazodone or melatonin, and focus on sleep hygiene first.
We continue our critical countdown with medication number 8. This category is used daily by millions, often without a second thought. First-generation antihistamines like diphenhydramine, Benadryl, and dimenhydrinate, Dramamine. You take these for allergies or motion sickness, or sometimes even just as part of a combination cold medicine. But structurally, they are almost identical to our sleep aids for medication number 9. They are potent anticholinergic agents. The consequence is that daily insidious brain fog. You feel slow, confused, and you struggle to recall simple names or facts. This is not a side effect. This is the drug working. It is actively blocking the acetylcholine needed for learning and memory. Daily use, even at low doses, means you are starting every day with a significant memory deficit, contributing to your overall anticholinergic burden. I had a patient, Mr. Henderson, 70, who took a small dose of Benadryl every night for seasonal allergies.
He was convinced he was suffering from age-related memory loss because of his daily confusion. We simply switched his allergy medication to a non-sedating alternative like Zyrtec or Claritin, and his mental clarity returned dramatically within a week. The chronic confusion was entirely drug-induced. My rule is non-negotiable. If you're over 60, you must avoid first-generation antihistamines for chronic use. Ask your doctor or pharmacist to switch you to a modern, non-sedating alternative. There is no reason to trade clarity for comfort.
We continue our countdown with medication number 7. This category is frequently prescribed after falls, back injuries, or severe pain, common problems for seniors. Muscle relaxers, such as cyclobenzaprine, Flexeril. These drugs serve a purpose. They are potent sedatives designed to break the cycle of pain and muscle spasm. However, they carry one of the highest risks for cognitive decline due to their powerful anticholinergic and sedating properties. Muscle relaxers are a double whammy for your brain. They not only block acetylcholine, the memory fuel, but they also sedate your entire central nervous system. This dual action is particularly toxic to the aging brain, causing dizziness, confusion, and contributing heavily to your anticholinergic burden. The greatest danger is their tendency to cause dizziness and increase the risk of falls, which, ironically, is what leads many people to get prescribed them in the first place. I had a patient, Mrs. Green, 68, who was prescribed a muscle relaxer after a minor fall. The pain was gone, but her family noticed she started forgetting conversations immediately. She felt perpetually foggy and unsteady. We immediately discontinued the drug and switched her to targeted physical therapy. The confusion cleared completely within 10 days. My rule is to limit use to acute, short-term pain relief, no more than 1 week. For chronic muscle pain or spasm, the solution is not a pill that blocks your memory. It is targeted physical therapy, stretching, and non-pharmacological treatments that address the root cause of the structural issue.
We continue our countdown toward the most dangerous medications in your cabinet. Part 3 focuses on necessary prescriptions that often involve the greatest memory risk. You must use this knowledge to discuss alternatives with your doctor immediately. We begin Part 3 with medication number 6, drugs prescribed for overactive bladder and incontinence, such as oxybutynin or tolterodine. This is the classic trade-off problem that geriatricians hate. These drugs solve the urgent problem of incontinence, but they do so by being powerful anticholinergics. They block the acetylcholine signal not just in the bladder, which stops the urgency, but also directly in the brain, which stops the memory. I had a patient, Mrs. Evans, 75, whose life was transformed by stopping her incontinence issues. But a few months later, her family noticed she started repeating stories and losing items constantly. We had traded bladder control for memory function. We immediately switched her to non-anticholinergic alternatives like Myrbetriq, and her short-term memory stabilized. Never stop these pills suddenly, but ask your doctor, is this specific medication highly anticholinergic? Can we switch to a modern, different class of drug, or can we try behavioral training first?
Medication number 5 is perhaps the most dangerous category for memory. Benzodiazepines, including names like Valium, Xanax, and Ativan. These drugs are potent sedatives that slow down brain activity. They are proven to cause anterograde amnesia, meaning they block your brain from forming new long-term memories while you are taking them. They don't just sedate you, they actively interrupt the memory transfer process. For seniors, the risks are compounded. Chronic use not only causes severe dependency, but the associated dizziness and loss of motor control dramatically increase the risk of falls, the very type of injury that can lead to permanent cognitive decline. These drugs are intended for short-term use, 2 to 4 weeks maximum. If you have been taking a benzodiazepine for years for sleep or anxiety,
You must schedule a conversation with your physician to discuss a safe, slow tapering plan and cognitive behavioral therapy, CBT, alternatives.
Our final high-risk prescription in this section is medication number 4, tricyclic antidepressants, or TCAs, such as amitriptyline. While these are used for depression, sleep, or nerve pain, they possess one of the strongest anticholinergic effects of any drug class. Studies show that long-term use is associated with an elevated risk of dementia because they contribute heavily to the brain's overall anticholinergic burden. They are a decades-old technology that modern medicine has largely replaced. If you are currently taking a tricyclic antidepressant, please understand that safer, modern alternatives exist that do not carry this severe cognitive risk. Schedule a review with your primary care physician to discuss switching to an SSRI or another class of antidepressant. Never just stop taking this medication, but demand a conversation about safer options for your long-term memory. We have reached the most critical section of our countdown. Part 4 exposes the categories that either carry the highest anticholinergic load or, in the case of our number 1 warning, represent the greatest total risk to your brain. We begin Part 4 with medication number 3, certain drugs used chronically for stomach acid, heartburn, or ulcers, historically including compounds like ranitidine. This is another common long-term prescription that harbors a hidden risk. Certain older GI medications contain an unadvertised component with anticholinergic properties. You take them for relief, but they contribute daily to your memory fog. I had a patient, Mr. Stevens, 78, who had taken the same heartburn medication for 20 years. His memory decline was slow but persistent. When we reviewed his full drug history, we found that simple GI pill was a major chronic contributor to his anticholinergic burden. It was an easy fix, but the damage was already done. If you are on a chronic acid reducer, ask your doctor to review your prescription and ensure you are on a modern alternative that is non-anticholinergic. This is a simple safety check that protects your brain from long-term, unnecessary exposure. Medication number 2 is the toughest category on our list. These drugs are necessary for movement, but they carry the highest possible risk: certain medications for Parkinson's disease. Drugs like trihexyphenidyl are powerful anticholinergics. They are essential for managing the motor symptoms of Parkinson's. However, their impact on the memory fuel, acetylcholine, is so massive that cognitive impairment is often an unavoidable trade-off. For patients with Parkinson's, the balance is delicate. The goal is to maximize motor function while minimizing cognitive risk. You must be under the care of a specialist, a neurologist, who can constantly monitor your memory function and adjust your dosage, ensuring you are not sacrificing vital cognitive capacity for movement. We arrive at the number 1 most common and most dangerous risk to the aging brain: polydrug use, or the anticholinergic accumulation. The ultimate danger is not one pill, it is the combination of 2, 3, or 4 low-risk pills. Imagine taking a low-dose sleeping pill, medication number 9, a low-dose allergy pill, medication number 8, and a low-dose bladder pill, medication number 6. Each pill, taken alone, is a low risk, but when you take them together, their anticholinergic effects add up geometrically. 2 low-risk pills can easily equal 1 toxic dose. Polydrug use is the number 1 driver of sudden, acute confusion and memory loss in seniors. You must ask your doctor to review your entire medication list to calculate your total anticholinergic burden. We have navigated the 9 most dangerous medication categories, and you have seen the cumulative risk posed by the anticholinergic burden.
I know this information can be frightening, but I want you to remember the most important lesson of this entire video. Knowledge is power, and you are not a passive recipient of your doctor's prescriptions. You are a partner in your health. Your goal is not to leave this video and feel panic. Your goal is to schedule a review with your physician. And this time, you will lead the conversation. You must use this script. 1. The request. Doctor, I am concerned about my anticholinergic burden. Use that specific term. 2. The goal. I want you to review all of my current prescriptions, including over-the-counter sleep and allergy aids, and identify any medication with anticholinergic properties. 3. The alternative. For any drug that scores high on the anticholinergic scale, I would like to discuss a safer, non-anticholinergic alternative. This approach is authoritative, respectful, and will ensure your physician takes the cognitive risk seriously. I must give you a firm, non-negotiable warning. Never, under any circumstances, stop taking any prescribed medication without the express supervision of your doctor. Stopping abruptly can be far more dangerous than the risk to your memory. The long-term solution lies in non-pharmacological alternatives. These pills are often treating symptoms, anxiety, sleeplessness, pain. You must address the root cause with sleep hygiene. Not pills, but routine, diet, and posture. Physical therapy, not muscle relaxers, but strength and flexibility. Meditation or CBT, not benzodiazepines, but techniques to manage anxiety. This is the path to protecting your brain naturally. The UCLA study was a gift. It gave us the proof. Now we use that proof to empower our decisions. You can protect your memory, maintain your focus, and reduce your risk. This is a shared journey. Which medication category on this list surprised you the most, and what is the first alternative you will discuss with your physician? Share your plan in the comments below. Your story will empower countless others. If you found this knowledge valuable, please subscribe to the channel. I'm Dr. Anya, and I'll see you in the next video.